Reversing Propecia side effect. In this video, guys, I will talk about how to reverse post-finasteride syndrome, how to reverse the really bad effects of medication that is blocking 5-alpha reductase enzyme. Okay, so if you stop Propecia finasteride and you are experiencing loss of libido, erectile dysfunction, depression, anxiety, muscle loss, brain fog, neuroinflammation. This is all because of the Propecia finasteride. Okay, so don't get fooled. Many guys experience these side effects. Okay, medical doctors, they will tell you it's only really small percentage of guys experiencing these symptoms. Over the maybe 2 years, I work with almost 200 plus guys, so they are not wrong. I have seen the blood test, okay, I have seen the Dutch test. I see really the negative effect of Propecia, so if you need my help, consultation, coaching, under this video you will find the email for coaching. Yeah, so the main reason, okay, why Propecia should work is that it's blocking 5-alpha reductase enzyme that is converting testosterone to DHT, and DHT is the kink male hormone. All the positive effects from testosterone are coming from DHT. Even I always try to explain all guys that you don't even need nootropics, because if your DHT is like over 60, 80, okay, you are boosting your own nootropic stack. You are calm, you are, so you can work under high stress, no fear, all these kind of things. So you need to understand how important 5-alpha reductase is, and of course DHT. Okay, so by blocking 5-alpha reductase enzyme, most guys, they will run into high estrogen issue. Okay, so they at the end they have lower DHT because estrogen is fighting with DHT for binding, or converting. Yeah, so you have low neurosteroid, allopregnanolone. Okay, this can lead to depression, anxiety. Allopregnanolone control Gaba A receptors. Okay, so we are talking about anxiety, panic attacks. I used to have like 10 panic attacks per day when my DHT and 5-alpha reductase were not functioning. Okay, so what you can do about this? Okay, so first of all, stop all 5-alpha reductase inhibitors. Even topical application will have the less side effect, okay, things like minoxidil, but there is still some effect, especially when your levels are already low. Okay, so but there are also natural things that can block 5-alpha reductase inhibitors, that can block 5-alpha reductase, things like saw palmetto, astaxanthin, high dose omega-3, PUFA, so be careful. Okay, so another thing is to fix estradiol. Okay, so estradiol, the best way is to keep in certain range, like 20 to maybe 35 picograms per milliliter. Okay, so the problem is some guys, they, for example, try to fix Propecia and finasteride side effects. They try TRT and they come to me and they tell me, okay, but my testosterone is 1200, why I don't see any benefits? Okay, and I look at the whole hormonal profile and I see immediately that, with estradiol like 60 or 100, okay, so it completely negate all the benefits of high testosterone. Okay, so it's not like I have high testosterone like I have high estradiol. It doesn't work like that. Yeah, so because it also compete for DHT pathways if estradiol is way too high. Okay, there are several ways how you can lower estradiol. I have a few videos. If you need my help directly, you will find the link for the coaching. Yeah, so estradiol can also have a negative effect on insulin sensitivity. Also, guys on Propecia finasteride, okay, 5-alpha reductase enzyme also affect bile flow. Okay, so how you detox things like estradiol, for example, but also how you detox finasteride Propecia from your body, because it can take up to 2 years to get rid of Propecia finasteride, okay? So, and 5-alpha reductase enzyme, blocking 5-alpha reductase enzyme reduce bile flow, okay? So your detox pathways are affected and not functioning properly, okay? So you can do also like low-cost homocysteine test, okay? Many guys, many PFS guys, they have elevated homocysteine, okay? Do also B6, B12, B9, B12 from blood test, okay? So take a look at these markers, okay? So another thing, thyroids, okay? Because of the chemicals inside of the Propecia, thyroids are affected. I work with many young clients, okay, and they have thyroids like an old man, okay. So especially low 3 has negative effect on 5-alpha reductase enzyme activity, okay. So maybe you can increase DHT, but you also need other cofactors like proper levels of T3. You need to have proper levels of IGF-1, okay. So, and then DHT will also upregulate 5-alpha reductase enzyme, and we are on the way to recovery, okay. So check your prolactin, okay. So in many guys I see prolactin from 15 to 50, okay. So it's extremely high if you want to function like a king in the bed, okay. So if you want to have a good motivation, drive, okay, your prolactin need to be less than a 7, okay. And if it's 15, 50 is already crazy, but I had also client with that. So this will negatively affect also your dopamine levels, libido, you know, drive, motivation, all these kind of things, yeah. So elevated prolactin is causing low dopamine, but also Propecia is affecting dopamine signaling directly. Dopamine itself can have a negative effect on androgen receptor signaling, okay. So we are fixing D2 receptors because they can be downregulated quite easily, dopamine 2 receptors, okay, and we are also increasing dopamine. There are really good ways how to do this, okay, properly, yeah. The problem is if you don't know how to do it, you can downregulate really easily, okay. So I will give you a tip, for example, mucuna, yeah, but many guys, mucuna is extremely strong in action, and you really need to know how to make cycles with mucuna, but also you need to have a cofactors, okay. Without these cofactors, even mucuna will not work, but mucuna like override all the steps to dopamine production, and also mucuna can have a positive effect on androgen receptor signaling itself, okay. But you do it incorrectly and you will damage your dopamine receptors even more, okay. At the end, I want to also explain you one thing, okay, because I get this question a lot. My doctor did the blood test and DHT was okay, so why I still get no improvements, okay. So, and I explained this yesterday to my client, okay. So testosterone can be metabolized into 5-alpha and 5-beta metabolites, okay, but 5-alpha are definitely much more potent and 5-beta are extremely weak, okay, leading sometimes to extra estradiol and so on, okay. So if you improve dopamine, insulin resistance, okay, so if you fix your thyroids, this can help you shift the DHT production to 5-alpha, okay. So 5-beta is much less androgenic and weak, okay. So guys, if you need my help, my coaching, under this video you will find the email, and let me know what you think.